Top 5 vitamins to unclog your arteries naturally and prevent heart attack. Did you know that just one small change in your daily vitamin intake could be the fine line between maintaining a healthy heart and suffering a sudden, life-altering stroke? Many people over the age of 60 believe that eating enough leafy greens, taking calcium, and exercising regularly is enough. But what they don't realize is, being deficient in just 5 specific vitamins can silently lead to atherosclerosis, uncontrolled high blood pressure, and ultimately, a collapse without warning. Tragically, some people take their medications on time, go for regular checkups, and still don't wake up one morning. And when doctors review their medical records, everything looks normal, except one crucial factor. They were lacking the key nutrients that keep blood vessels open, elastic, and functioning properly. In this video, I will reveal the top 5 vitamins that have been scientifically proven to cleanse arteries, reduce the risk of dangerous blood clots, stabilize blood pressure, and protect your heart naturally, safely, and sustainably. Especially, the number 1 vitamin works almost like aspirin in preventing stroke, but without causing stomach ulcers or internal bleeding. If you're middle-aged or older, or currently taking cardiovascular medication, then this could be the most important video you watch this week. Vitamin K2, the calcium traffic controller. Vitamin K2 is not a household name for most people, but in the world of cardiology, it's considered a silent hero, capable of protecting your arteries from an invisible threat: misplaced calcium. You've probably heard that calcium builds strong bones, and that vitamin D helps absorb calcium, and that's true. But without K2, that calcium can easily end up in the walls of your arteries instead of your bones. The result: arterial calcification, loss of elasticity, increased blood pressure, and eventually, heart attacks or strokes. Vitamin K2, especially in its MK7 form, acts like an intelligent traffic controller, guiding calcium into the bones and keeping it away from blood vessels. I once had a patient, Mr. John, 72 years old, who had been taking calcium and vitamin D daily, yet he constantly felt tired and short of breath. A CT scan revealed severe calcification of his aorta. After introducing a daily K2 MK7 supplement and adjusting his meals, his blood pressure stabilized and he could walk in the morning without getting winded. Just 1 small capsule a day, or natural sources like natto, chicken liver, aged cheese, or pasture-raised eggs, can drastically lower your risk of stroke and heart attack. Don't let vitamin K2 continue to be the forgotten key in your heart health journey. Vitamin A, retinol, the inner lining defender of your blood vessels. Every single blood vessel in your body is lined with a delicate layer of cells known as the endothelium, the control center for blood flow and vascular health. When this layer becomes inflamed, scratched, or even slightly damaged, your body responds by forming plaques to patch it up. And that, unfortunately, is the first step toward atherosclerosis. Vitamin A, particularly in its active form, retinol, not to be confused with beta-carotene found in vegetables, plays a crucial role in maintaining and restoring this endothelial layer. It acts as a protective barrier against microscopic damage, significantly lowering the risk of plaque formation. One of my patients, Maria, a 65-year-old woman with a history of high blood pressure and prediabetes, she believed she ate quite healthily. However, her blood tests revealed a severe retinol deficiency. After several months of supplementing with cod liver oil and incorporating eggs, beef liver, and whole milk into her diet, her systemic inflammation markers dropped significantly. Her blood pressure stabilized and she began sleeping soundly again. This is a powerful reminder. Eating carrots is not enough. Older adults, especially postmenopausal women, have a reduced ability to convert beta-carotene into retinol. That's why if you're serious about protecting your vascular health, prioritize active vitamin A in the form of retinol, whether through high-quality animal-based foods or appropriately dosed supplements. It's a foundational step in keeping your endothelium strong and stroke risk at bay. Vitamin E, the antioxidant shield that protects your arteries. Did you know that one of the primary drivers of atherosclerosis is oxidized LDL cholesterol? Once LDL becomes oxidized, it turns sticky, clinging to the artery walls and triggering inflammatory responses that eventually form dangerous plaques. Vitamin E acts as a powerful natural shield against this destructive process. As a fat-soluble antioxidant, vitamin E defends the lipids in your cell membranes and endothelial lining from free radical damage. This protection becomes even more vital as we age, when the immune system weakens and oxidative stress accelerates. I once worked with a 70-year-old gentleman named Richard, who was hesitant to take statins due to concerns about side effects. By adjusting his diet to include almonds, extra virgin olive oil, sunflower seeds, and a small amount of natural vitamin E-rich margarine, we saw a remarkable drop in his inflammation markers. His hands and feet felt warmer, he began sleeping more deeply, and even his memory improved. Sadly, many people unknowingly suffer from vitamin E deficiency because of low-fat diets or an overavoidance of healthy oils and seeds. If you're over 60, start with simple, effective steps: a handful of almonds, a spoonful of extra virgin olive oil, or a sprinkle of sunflower seeds each day. These small additions create a powerful defense, keeping your blood vessels resilient, blood flowing smoothly, and reducing your risk of heart attack and stroke. Vitamin D, the sunshine hormone and a natural weapon against high blood pressure. Commonly known as the sunshine vitamin, vitamin D is now recognized by modern medicine as a hormone that regulates hundreds of vital functions in the body, and among the most critical is its role in cardiovascular health. One key mechanism is vitamin D's ability to stimulate the production of nitric oxide in the endothelial lining of blood vessels. Nitric oxide is a powerful natural vasodilator. It helps blood vessels relax, reduces blood pressure, and improves circulation. When vitamin D levels are low, blood vessels become stiffer and less responsive, increasing the risk of hypertension and vascular damage. That's why many individuals continue to experience stubborn high blood pressure despite taking medication. I remember one patient, Linda, age 66, who frequently complained of cold hands and feet, morning fatigue, and poor sleep. Her blood test showed a dangerously low vitamin D level, just 17 ng per ml. We started her on a daily routine of morning sunlight exposure, low-dose D3 combined with K2, and added fatty fish, egg yolks, and mushrooms to her meals. Within 3 months, her blood pressure stabilized, her sleep deepened, and most notably, her anxiety levels significantly dropped. This is not uncommon. Over 70% of people over 60 are vitamin D deficient due to reduced sun exposure, impaired synthesis, or diminished liver and kidney function. The result? Less elastic arteries, increased pressure, and a ticking bomb time for an unexpected stroke. The good news is you can start changing this today with just 15 minutes of sunlight each morning, a diet rich in salmon or shiitake mushrooms, and considering a D3 supplement paired with K2. A simple daily habit, yet a powerful way to enhance arterial flexibility, stabilize blood pressure, and lower your stroke risk. EPA, the miracle fat that works like aspirin without the side effects. Did you know that more than 80% of strokes and heart attacks are caused by blood clots? When a plaque in the artery ruptures, platelets rush in and clump together, forming a clot that blocks blood flow. In mere seconds, the heart or brain can be deprived of oxygen. This is why many doctors prescribe low-dose aspirin to reduce platelet aggregation. But aspirin often comes with unwanted side effects, stomach ulcers, bleeding, and interactions with other medications. Enter EPA, eicosapentaenoic acid, a powerful anti-inflammatory omega-3 fatty acid that naturally supports cardiovascular health. EPA regulates platelet activity, reduces blood viscosity, and prevents clot formation, all without causing ulcers or bleeding. I worked with Steve, a 67-year-old who had experienced a minor stroke and was put on aspirin. Within 2 months, he developed gastric pain, insomnia, and weight loss. We shifted his regimen to include EPA-rich foods like salmon and sardines, along with pharmaceutical-grade IFO-certified fish oil. The results were remarkable. His blood pressure slightly dropped, inflammation markers decreased, and cholesterol levels improved, all without any gastrointestinal issues. But here's something important. Not all omega-3 sources are rich in EPA. Flaxseed oil and chia seed oil mostly contain ALA, and older adults have a poor ability to convert ALA to EPA. That's why choosing the right sources is essential. Opt for low-mercury fatty fish, high-quality fish oil, or cod liver oil. Just a small daily dose can be a powerful line of defense against thrombosis, vascular inflammation, and the sudden cardiovascular events no one sees coming. Final thoughts, emotional closure, and call to action. We've just explored 5 essential vitamins and nutrients, seemingly simple, yet profoundly powerful, that hold the key to keeping your arteries clear, your heart strong, and your mind at peace as you journey through your golden years. You may have heard of them before: K2, A, E, D, and EPA, somewhere in passing. But it's only when you understand how they work, how they support one another, that the full picture becomes clear. These aren't just isolated pills. They form a natural, intelligent, and deeply compassionate protection system designed for the human body. Take a moment to reflect. Vitamin K2 is the commander that guides calcium to where it belongs, strengthening your bones without clogging your arteries. Vitamin A is the protective coating on the inside of your vessels, preventing small scratches from turning into fatal wounds. Vitamin E is the shield that defends against free radicals, preserving your vascular structure from the corrosion of time. Vitamin D is the conductor of circulation, helping you maintain stable blood pressure and mental clarity. And EPA, the silent warrior, prevents deadly clots before they can even form, keeping your blood flowing gently like a peaceful stream, untouched by the sudden storm of a heart attack or stroke. You see, these are not just vitamins. They are hopeful. They are strong. They are the gift of more healthy years to spend with your loved ones. And the most beautiful part is this: you can start today. No prescription required. No waiting for illness to strike. No need to spend thousands of dollars trying to buy your health back. You only need to look at your plate and add eggs, liver, fatty fish, and healthy oils. You only need 15 minutes of morning sunlight. You only need one simple blood test to know what your body is missing. And you only need a little more awareness to recognize what's right for your heart. Your journey to a stronger heart, clearer mind, and longer life begins with one simple step taken today.